you mentioned about you seeing results immediately, and often with you know, the practical implications of delivery of the laser is you think, well, you'll give, you know, 2 treatments twice a week for 3 weeks. That's what a lot of the studies have been shown. But I've found myself that it's often immediately after treatment that the dog is so much more comfortable.
I mean, even during treatment, so, you know, more so from a sort of MSK perspective. So if we have a dog that's coming in and say it's been referred for a osteoarthritic maintenance, if you like, yes, it's been referred for the OA problems and the pain associated with that and the reduced mobility, etc. But quite often, secondary to that, we've got the compensatory muscular issues because the dog's not been moving properly and it's been counterbalancing and compensating, and you can have transverse lines of compensation and the fascia's tight. So even before we start to get down to dealing with the arthritic issues, and in particular any joints that the dog's having particular problem with, then we start to look at reducing inflammation and tension in the muscle and the tissue and the fascia. And immediately as you start to do that, both by manual therapy and applying the laser, the dog's behaviour changes immediately. You know, they'll start to lick and chew, their eyes will soften, quite often they'll get nice and comfortable for you to continue to work. And more often than not, you'll find that the dog will present to you which bit that, you know, it's sore and it wants you to put the laser on, so to speak. So, and when we have owners in the building, we don't have owners in the building at the moment, obviously due to COVID, but, you know, even owners would comment and say, oh my goodness me, you know, that's amazing. So it was even aware, you know, owners were even aware, and they're completely untrained in, you know, animal behaviour and the application of laser therapy and such like. So it's a marvellous piece of kit.